We had to wake Commissioner Weber out of retirement nap back there. Okay. Kathy, I think this is mostly you today, right?
I'm not
A
sure.
few things, okay.
So Kathy Fung Baxter, Finance Director, and today's workshop is for mental health, behavioral health tax, and for those departments that have received an allocation of that tax
From that,
revenue.
yeah, okay.
Right, from that fund. And there's a number of them, and they are all covered in tab 10 of your notebooks. And there is a pretty large spreadsheet that courtesy of our Health and Human Services Department. And they present it in a manner where you can see every department's allocation. You can see the allocation they received for 24, as well as the allocation that they're proposing for 2025.
Okay.
And they also provided the beginning balance that's estimated to be in this fund. So the beginning balance for 2025 is approximately $5.3 million.
If I might interrupt,
Yes.
there's a little preliminary stuff I'd like to get clear. Because we have a general fund that we can allocate to the functions that are currently allocated by, that are covered by the behavioral health tax, I think we should separate the discussion between, do we want the behavioral health tax money, or do we want to fund that out of the general fund? That way, whenever we're allocating taxpayer funds, we get really to realize what, it's more transparent in my sense. It's way too easy, and I should say, it's really difficult to know exactly what the public means. Like, we talk about taxation without representation, and we will face an issue here, but half the people don't vote, half the people get elected to represent somebody, and half of the taxes are often split about half. So that's an eighth of the vote. So at best, of the people, at best you can say 15% of the people determine the taxes. But you and I, and well, I for another 2 months, are on the hot seat for responding directly to the public. So
Yeah, I think I understand what you're saying. General fund, should the general fund pay these and we being reimbursed by the fund by what's in this balance? But then we would realize that at some point in time, we're gonna have to make that up or figure that out.
right, so I would look at it as you have a revenue stream, you have a revenue, and we should look at this tax essentially. Well, let me ask you this. If we could get money coming in with no strings attached, is that better than money coming in with strings attached? I mean, clearly we want the maximum freedom on our funds, right? So I look at these funds as, do you need them to carry out your business as people would like you to carry it out? And that's just an income stream, if you will.
Yeah,
Different than the decision of, do we want to spend it here, 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 and here?
right. No, I get what you're saying. Yeah.
Okay.
Well, I don't think it much matters. It's all taxes, whether it's coming from the general fund or not. It's do we want the program? Is it going to meet a particular need as expressed by the voters, either through the election of the officers or a tax? One of the reasons that I favored sunsetting this tax because it had never been voted on. It wasn't required to be voted on. The state legislature set up the rules, and that money can only be used for behavioral tax purposes. But those are the rules that we follow. The discussion should happen at every budget time. Are these programs desirable programs? Do they meet the original intent? And have we figured out a way to hold the departments accountable for the expenditure of that fund? And we have a difficult time coming up with the kind of rubric or measurement tool to determine, has the behavioral health tax been effective? We've never established what makes it effective. We just, does the program qualify for these funds? If the answer is yes, then we assign it. We've never burdened ourselves with demanding a form of accountability, despite what campaign signs say. Unless you have measurable performance goals, campaign signs that say accountability is not even worth the paint that's written on, because you're not fulfilling what makes it accountable. With all of the human services programs, it's extremely difficult to come up with measurable accountability standards because the variabilities change so much. We've been asking for years for a method to hold the participants of drug court accountable for the resources that we've spent for them. And we get some figures, some surveying instruments, but the fact of the matter is they move all over the place. They're free to move once they're done with the program or even before. And it's extremely difficult to follow up. Well, 5 years down the road, are they still clean and sober? I mean, that's one of the frustrations that you have to deal with.
I don't really agree with you on that. I mean, in order to go into drug court, you have to sign a contract. And that contract can include anything and everything. But if we throw our hands up right at the beginning and say, oh, we can't do this, then certainly we can't do that. But anyhow, that's beside the point here right now.
All of these departments that receive this allocation are part of the general fund, and they submit reimbursements for their expenditures based upon and most of it is individuals that they have attributed to the program, the requirements of this tax. So they are part of the general fund. They're receiving a transfer in from the mental health, the behavioral mental health tax.
You know, that reminds me of a story when I first came into office. We met back there and one of the department heads wanted a new car. And the other commissioners asked the very first question was, is it in the budget? Now, you know the vagaries of the budget. And finally, even though I was a newbie, I said, wouldn't something to the effect that the question isn't whether it's in the budget. The question is whether you need it. And if you need it, whether it's in the budget is irrelevant. It's up to us to provide the car. And that's the same attitude I'm trying to say here. Any program that we deem should proceed on should be driven by us, not by strings attached.
Yeah.
So how would you like me to proceed with this? Would you like me to go over the highlights of, so for example, Superior Court is receiving $115,875 of this fund. And basically they received almost the exact same amount in 2024.
No, I think you should
Gina,
proceed like you had planned.
Right.
Yeah. So the question we ought to be asking is, what are they spending that behavioral health tax dollars on in Superior Court? I wasn't aware they were doing any treatment in Superior Court.
It's for, it's a position, it's a deputy clerk that I believe they've attributed, handles the paperwork and the processing. So it is actually one FTE.
Yeah. Most of it's FTE. Through the total program, it looks like we fund 14 FTE, which takes about 2.9 of it. And then about 50,000 is in other.
Well, when we get to the jail has the largest allocation, and it's primarily for,
Mental health treatment.
yeah, for corrections. It's for mental health services that are provided by a third party.
Yeah.
So I don't know why we have the clerk getting money out of this fund. Gina, do you know? You'd have to come up.
Yeah. And Stacy's online
Mhm.
as well.
Gina James, Health and Human Services. My understanding is it's for clerk time towards therapeutic court programs. There's some role that the clerk's office has with those therapeutic court programs and putting those on. And so, or the court appearances. And so that's my understanding, but I'd love for Stacy to, if she's on, to elaborate.
I am on, and Gina is absolutely correct. That is a clerk. Actually, if kind of confused because it was referred to as Superior Court, and I'm not Superior Court, so
Right.
the clerk's office, and that is attributed exactly like Gina said. We clerk the mental health court hearings, drug court, all of our therapeutic court hearings, and all the paperwork that's involved in processing those case types.
Okay, so I'll continue on. Then we also have the prosecuting attorney's office. And again, this is a number of positions, primarily positions and their associated benefits. And prior year, it was 0.87 FTE for a total of $153,204. And for 2025, they're proposing 362, sorry. And basically the same positions, and for pretty much the same rationale. It's providing funding for those positions that are involved in those court cases.
Just a quick question on the numbers. I can't do it that fast in my head. From 0.87 to 0.89, there's an escalation. Does this number address the COLAs and so forth that we have in there? So that's.
Yes,
Okay, thank you.
yes.
So there's a $15,000 increase for a child sex case provider. That's the very last line in that subcategory. That's the new addition.
Well, actually it was in 24 and it's also in 25. What they did is they just attributed a percentage of the FTE for 25, and they didn't have an FTE for 24. That may have been a clerical error, but.
Oh, so that column should have 0.02 in it also?
Yes, yeah,
Got it, thank you.
that's what it looks like. Then the Office of Public Defense, they have almost 2 FTEs. So prior year and 2025. Prior year was 299,369. And then for 2025, they're proposing $318,029, which again, that's attributable to our COLA increases. And then we have Superior Court, and this is a combination of both a court commissioner's salary, and then as well, those case workers and positions that are actually in drug court. So it is, prior year was 1 FTE, and this for 163,641. And for 2025, they're proposing the same FTE at $163,290. And it looks
wondering
like it's just a little decrease because they selected a different commissioner to represent the expenditure.
Well, and it also looks like, I'm wondering that line 47 for incentives, bus passes, et cetera, it's been 12,000, now it's 1,200. Did they maybe just drop a zero?
That's what it looks like.
I don't know, I can find out.
That's correct?
Yeah.
Oh, okay, all right,
I caught that same thing.
all right.
Yeah, and they probably looked at what this is what they had proposed for their budget, and it may be that they weren't actually expending those levels of expenditures.
Okay.
It's interesting how the totals end up the same.
End up the
though,
same, yeah.
In both years. I don't see where the extra reduction is accounted for elsewhere. Where's the expenditure added then?
Well, the salaries did go up, but then that particular expenditure went down, so.
I'm just looking at,
On the line for the court case aid, it actually went up.
well,
Almost 10.
they're dropping $11,000 and that doesn't reflect it in the totals. So, oh, well.
I'll go back and look at it. Double check it. So, and then for on page 2 of the handout, we had some additional, and they do split up the drug court between, I think between drug court and therapeutic court, mental health. Yeah, so they split their expenditures up, even though it's going to the same department. And so the second page has the case workers, case positions, and for drug court. And that's a total, they had a total of 4 in 24 that they had proposed for 453,166. And for 2025 budget, they're proposing 3 positions at 487,312. I'm not sure, so there may be a typo on that one because the FTE, the first FTE for a case aid is showing up in 24, but it's also showing up in 25 under the dollar amount, but they didn't put the FTE, so it may be 4 to 4. If that makes any sense.
Yeah.
So we went down an FTE?
Well, that's what the spreadsheet says,
Oh, yeah,
but
right, I got it now.
yeah,
I'm
but the
sorry.
dollar amounts
Yeah.
indicate that
Yeah,
it's
clearly
same
not-
number of positions.
Yeah.
And then they do have some other expenses related to that. They have some travel, training, professional and contracted services, a software maintenance program that they maintain. And so that makes up their total of 487,312.
Gina, I had a program question. I know that the state also provides CJTA monies for drug court. So they have more people than just 4 FTEs for drug court, right?
I don't know the total amount of FTEs that drug court has. CJTA, they are utilizing CJTA funds as well, but CJTA can't pay for FTEs. It pays for.
Can't pay for what?
Can't pay for FTEs, so it can't pay for staff time. It pays for treatment services
Treatment services.
primarily, and then it can pay for, I'm guessing, part of the decrease in that. Oh, that was mental health court. I was gonna say they utilize it for some recovery support services as well. Ancillary type like GED classes, things like that.
So before the mental health tax, we were paying for that staff out of general funds.
I don't know for sure. I wasn't involved in their budget at that time.
Yeah, this actually is a good example of why I would treat the task and the budget initially independent. So we decide what task we're going to get. And then the experts will try and find out where do we get the money. Well, we can do a mental health tax. Okay, that's one possibility. But it should be really independent of this. And so we don't have the question of, well, CJTA is involved in here or not. I mean, we can see it all.
Yeah. Yeah.
The next department that has expenditures is our corrections department. And this is, has 2 FTEs, both in 24 and in proposed 25. And for a total of, and there's, in addition to that, the largest amount of expenditure is the mental health services, which is $631,940, and they're showing that's same amount for both years. And then also MAT expansion and MAT medication in addition to the 2 positions. So for a total of, for 24, we had $1,315,039. And for 2025, we have $1,334,000 and 384,000. I'm sorry, let me start over. $1,334,382.
The mental health services, is that the contract with the, we'll get an answer in a moment.
Good afternoon, Marin Fox, Director of Corrections. The line item you're referring to, the mental health services, is part of our contract with NAFCare.
Right, and that's about half of what we pay out for NAPCare?
No, it's the total NAFCare contract is above 2 million. But that also includes the MAT expansion.
Right,
It's
so
listed here as well.
collectively, what we're seeing is about half of what you'd normally. Yeah, so hard to quantize and.
So it pays for the portion of our RN at booking that assesses for medical and mental health needs, as well as the time our contractor attributes to their nurses spending on inmates with medical and mental health needs.
So if I wanted to speak
sorry,
to a
mental health needs.
nurse at the jail, that nurse would not be a county employee, it would be a NAFCare employee.
That's correct.
And that that has gone up substantially also, like earlier today, we commented on the risk pool going up. This has gone up as a consequence of all kinds of liability also.
It has gone up. We entered into a contract with them that takes us through 2027 with fixed increases in the 3% range, which we believe was a very good business decision. So it hasn't gone up very significantly because we've been under contract
Prior
with
to
them.
that,
Right. We've
Yeah,
been under
prior to-
contract with them since 2020.
yeah.
And other of note as well, The MAT expansion is actually going to be 239,000 rather than the 385. We've gone out to get grants for this program as well. So we're receiving money from the state. And so as we've increased the money we're getting from the state, we're decreasing the money we're pulling from this fund.
Well, the expansion means that's what you pay NAFCare in addition in order to take care of Matt?
The expansion listed here,
Yeah,
yes, that's a portion of it. And then there's a second portion that's paid for by the state.
and the medication is obvious then, right?
Right, typically Suboxone, yeah.
If you talk to Brad, he's got a evidence room full of material.
They probably prefer those, but it's not what we're giving them.
But it continues to make a pretty profound difference in behaviors at the jail.
Yes, and we're required by RCW to provide that service.
But we didn't used to. I mean,
Right, we didn't used to be required to.
Yeah.
So that has changed in the last, 5 years. Jails are required to provide MAT services.
Well, I mean, you're in such an interesting area that you could ask questions all day long, but that would be always going off
Right.
further. And Kathy at some point will hit me.
are you, does the folks administering the MAT, are you able to encourage your guests to get onto MAT if they hadn't been? I know one is you continue it because they're already on it, but
Mhm.
there are new people that might not have started, and that,
Yes, we use it to taper our detox, people detoxing, which is safe and decreases liability. We also continue, as you said, and we're able to start people on the medication. We also connect them to a provider in the community when they're being released. And they leave the facility with medication to try to bridge that gap.
They have to agree to that, right?
Correct.
But if they're in withdrawal, they're going to agree. Yeah.
Yes.
I'm,
All right.
I'm kind of convinced that that is definitely one of the best benefits that money makes possible. I'm glad we have that tax because we were able to start paying for those required things, but we'll have to pay for it anyway, so.
Yeah, out of it, I was just trying to make notes here. I know corrections in your area, RCW required, we need to do that. Is it the same in juvenile services? I'm guessing it
I'm not
probably
sure.
is.
I'm not sure. I know that is true for adult jails. I'm not sure if that's true for juvenile.
And some of the
detention.
other departments, I know they provide support to you for that, but other than that, a lot of the other is something we choose to do because we think it has value. I think that's a correct statement or close.
Right, and the decision to fund that mental health expansion was made by the board in 2018 when we received a bid that increased our medical contract by a really significant amount. So at that time, the board was looking at ways to decrease the impact on the general fund. And it definitely seemed appropriate as a large portion of that contract deals with mental health and substance abuse. So.
Okay.
Okay, the next, the next department is our youth services program and services. This is our juvenile area. And so this is providing one FTE, both in 24 and in 25. And then some additional training, lodging, other expenditures. But the majority of the expense, so for 2024 is $139,903. And then for 2025, the proposal is $148,812. And that's primarily attributable to the salary increase, the COLAs for that one position. And I know George is online in case there's a question about their programming. Are there any questions?
George, there was a question earlier as to whether the mental health services was required. It is for jail inmates. What about those who are in your custody?
Good afternoon, George Moya, Juvenile Court Administrator. No, they are not required for juveniles. In fact, I'm embarrassed to say I don't even know what MAT stands for.
Medical assisted treatment?
Oh, definitely not.
Okay.
But the clinician for mental health services is not required either, right?
It is not required. It is a great need, not only for our community, for our services that we provide, for the youth that we have as in our facility. And that includes both for in custody youth and out of custody youth, those youth that are on probation. Mhm.
And your average census is lurking at around 9 to 12?
I can let you know, I believe today's lucky number. We are at 12.
So it's always interesting, at what point does the enrollment just justify a full FTE for services? Because they can't be busy all the time, right?
That is not, yes, partly yes and partly no, because that's not the full job scope or the major part of their job description. The way I like to look at this position and look at it in terms of three major components, staffing wise, meaning providing training to staff. We have four staff trainings that happen per year. So this juvenile clinician provides training for our in-staff for both probation and detention to keep us up on the best practices with mental health. So that's one component. The youth component is the other component, which is crisis response and check-ins with detention youth, and also check-ins with our probation youth too. We get lots of youth that come in and checking in with the probation counselors that may be at a mental health crisis. So that's where our clinician gets the response to that too. And the third component, it's continuity of care when you're looking at connecting youth to facilities. And we all know that in our community, we have a hard time having any mental health agencies here that are willing to take on an inpatient program. And so I know we've been working on trying to fix that problem in this community so that we are not having our youth in our community go to places as far as Seattle or even to another state like Utah, which is currently happening.
Yeah. Thank you, George. So then really the RCW required program that we need to do is through corrections. Okay. Just keeping it clear in my mind.
Okay, if there's no other questions, I'll go to the next one is our sheriff department. And this is related to responder program. This is in 2024, we had 2 FTEs and for 200 and a total of, with contracts with some professional services, outside assistance, we had a budget of $270,009. And then they're proposing for 2025, 2 FTEs with $268,654. And I believe the professionals that we had here was just for a portion of year when we were using an outside service.
Right.
And then we moved over to hiring individuals as county employees
Right.
to provide those functions.
And that's the 50,000.
Yes, so that's now off of 2025's budget, and that accounts for the difference. And these are additional expenses related to those two positions for uniforms, vehicle, things like that.
Do we have some examples of how this program is benefiting the community?
I think we have someone from the sheriff's department here to help us.
Troy Brightwell, Chief Criminal Deputy, Sheriff's Office.
Turn your light on.
There we go.
Mhm.
Troy Brightwell, Chief Criminal Deputy with the Sheriff's Office. We use our behavioral health responders in a number of scenarios. Oftentimes they're dealing with somebody that is in crisis and helping them to find programs that might get them back on track, and the goal of keeping them out of jail if they go into further crisis. One good example I can think of where they were working with our deputies was a subject that was in crisis. Despite all their efforts to de-escalate him, he actually ratcheted it up a lot and got a hold of a infant in a car seat carrier. They were able to distract him and get that baby away while our deputies took care of business. And I thought that was a great example of them working together. A lot of times what they're dealing with is someone that is causing a problem out in public, but not necessarily committing a crime, much more appropriate for a mental health response rather than a law enforcement response. So they've been able to take some of that weight off the deputies and provide that service to the community.
It's almost like a diversion program, so they don't get into the system, which is expensive, just the processing of the arrests and the booking and all that.
More of an early intervention.
Okay.
So along those lines, I remember, excuse me, a discussion where I had heard maybe some that are the employees you have now in this slot, where they were trying to build it into following the individual and making sure they had proper this or that. And I know my intent to support this was to help the deputy out there who's facing someone who's not rational, and I was glad to give them help, but I thought there were enough programs around the county that by the time, you stabilize the situation, maybe it takes an hour, maybe it takes 2 hours, and at the end of a day or two, you can hand that person off completely. Is that how it operates now?
There are some of the situations where they deal with it directly, where a deputy is not involved at all. We can divert those calls directly to them. There are some where they'll come out in the field and take over with the contact.
Now, a question on that one. That seems strange to me. So how do I distinguish that from something where you'd call Columbia Wellness or CIHS and you'd get them to handle the situation without involving the law enforcement agency?
So typically they are looking for us to assess the situation first, those other outside agencies. For us, when we're dealing with something, whether we respond first or we dispatch their behavioral health responders first, depends on basically an assessment of safety. If it is somebody that's
And that's what
really-
these folks do.
Yes, and they're immediately available to us. They are tied in with our dispatch system. We can send them the call. We can put them in contact with the person. And then oftentimes after these contacts, they will follow up with those individuals just to see if they're utilizing the resources that they've been steered towards.
That's kind of an optional aspect of their job.
Yeah, they're just hoping to have, a successful outcome. Occasionally, they do want to check and make sure that people are following the steps that they've laid out for them.
And as things would normally be, the incidences are usually on the weekends and at weird hours. Are these people always on call?
They're available to us. They work 40 hours a week, but they're available after hours if needed. If it is something after hours that needs a crisis response team, one of the other outside entities, we can call them, but oftentimes that does involve having the deputies wait on scene or continue to deal with the problem until they're available.
I'm having a hard time figuring out what they would do during normal hours because most of your trouble is going to be during non-hours, right?
No.
No.
It's all day long.
Right. So, but all day includes, let's see, 8 hours minus 24, 16 hours where there's no coverage per se.
So those are the hours where a lot of these other entities are open, or the resources that they refer them to will be open for their business hours. We do have a lot of people that are contacting us during daylight business hours.
So I should ask, what hours do these people have then? They have the midnight hours?
I believe they're working day shift hours, but we've had them work other shifts
See, that would
back when we had more.
that would contradict what you just said because all the other people have day shift hours also. I mean, Columbia Wellness and CIHS and Core Health.
Well, those are the resources that are out there, the different facilities that they're referring them to for their business hours. But our behavioral responders do deploy as needed when they're on
Yeah.
duty.
No, I figure having somebody on call is a good thing. I'm trying to figure out what 2 FTEs would do during normal working hours. But you could easily answer me by showing me the call sheet, I suppose, and I just don't know what's on there.
So I have their total calls for this year is about 225. Those are different contacts they've made out in the community.
Anyhow, I should stop. This is not really germane to this meeting, but those are questions for some future. But I appreciate your answers, Troy.
Thank you.
And then finally, we have just a small amount of administrative support that's provided by our Human Services Program for a total of, for 2025, $19,918 for a very small portion of the FTE. And in 2024, it was $11,002. The grand total of all of the departmental allocations and requests is for 2025 is $3,018,634. And then that would leave the fund balance, projected fund balance at almost $2.5 million. And so it's not quite enough to sustain the programs and the personnel through 2026, but a large portion of that could be expended in 2026.
I think we're obligated to honor a quarter boundary. So in other words, the tax could be imposed as long as we had 3 months lead time, or is it 6 months?
I
3
think
months?
it's 3. That's what I remember.
So the good thing about that is there's plenty of time to hash it over and
Right.
pound it into the ground.
Rick, you have plenty of time to hash it over and get the solution,
Yeah.
coming up with the $3 million for the programs.
Yes.
Maybe.
If you're suggesting that's a lot of money, you're right.
I am a little curious, Kathy, in line 163, you show a 2025 revenue of $150,000, and I thought the tax is over with. Where is that revenue coming from?
That is probably, they're estimating the investment income on holding these funds. So,
Sure, okay. Makes sense.
If we built it up enough, then we would never exhaust the fund.
yeah, that's an endowment.
Yeah.
So, are there any other questions on this? This is what we currently have in the budget, proposed budget for 2025.
I mean, it's pretty easy to see why that tax was implemented to start with. And I mean, that's a fair chunk of money.
Yeah, and like I said, all of these departments are in the general fund. And then I know that I think there's more planning and research related to our opioid funding, because there were some questions that maybe some of these programmatic items could be moved to opioid funding.
Well, I think that was kind of Commissioner Mortensen's point, is we've kind of attached this tax to this, and it's not necessarily attached at the hip to this. I mean, we funded, but there may be different sources that can do that.
And if we are successful at getting some kind of facility, and that's
Yeah.
going to be considerably more than $3 million to support, I would guess.
We won't be in office, but we might not even be alive by that time either. That's a very heavy lift.
Anything else?
I don't really have any, you know, we've seen the numbers quite often, and they're, the best thing to say is what you projected would happen is pretty much staying in line. We aren't seeing any surprises.
Right.
So it's doing what it's supposed to do. Yeah.
Yep. And the good news is, like I said, you still have fund balance available to bridge purposes for 2026.
Yeah. It is a public meeting, so if any questions or.
Is there a sense of priorities in these expenditures?
But the only one that what would pop in my head is, it sounds like we're pretty much by RCW that we got to take care of what they do at the corrections facility.
Right.
So that pops up as probably a little higher priority, because that's in RCW, and we need to.
Right.
So the commission has demonstrated its priority in eliminating the community programs that had gone towards supporting mental health mental health improvement activities. We had a number of youth-related programs that we no longer carry. We paid for a case manager for a 6-bed facility run by CAP for chronically homeless, disabled homeless men. So we've whittled away at those kind of programs. So it's kind of bare bones.
Did we ever really have that? I remember
Well, there
Judge
was
Putka was arguing.
There was a strengthening families program through 4-H. There was the case manager for the CAP group home. We had a contract with the Cowlitz tribe for a kind of a self-awareness, self-actualization program tied in with working with canoes. And I think there was some money that had been going to Nope, I get that mixed up with some of our document recording fees. Homework help at the community house. That came out of this, didn't it? Okay. Yeah, we don't do that anymore, so. Way back when, and again, the programs that were pretty difficult to demonstrate, they were effective. But
And we have an upper bound on how much a tax can be, right? 0.1%
I don't know.
tax rate. You know, Gina? Yeah. Otherwise, we raise it to cover the general fund.
Well, I remember being here when the tax was adopted. It was just before I joined the commission. And the Citizens Task Force or Mental Health Advisory Committee had recommended a division of these funds. One was for treatment, and one third for treatment, 1/3 for education and prevention, and then 1/3 was for the uninsured. And almost immediately, the one that fell apart because with the Affordable Care Act, everybody had access to insurance, so that fund could be used for other things. And that was also right around the time, a few years, the need for mental health treatment in the jails became pretty important. And we switched the priorities as that has gone on.
Go ahead, Mike.
Great discussion. Just a quick question. Any of the funds come from the state or federal to the Board of Health? Can that help in any way in this kind of, any of this?
You mean additional funds?
Right, some additional funds to maybe to help somewhere in some of these different sources where you can kind of make this even last longer in terms of what's in there right now, that we could take state and federal funds to maybe pay for some of these these various expenses. I'm just putting it out there. I have no idea. I don't know how because sometimes you have allotted funds that you can't use, but I'm just wondering if there's a way of extending this to where it's maybe 2 years more if we can bring in more funds.
So the counties are part of a regional behavioral health organization, BHOs, and Mr. Mortensen serves on the board for that, because the state no longer gives treatment dollars to the counties to disperse. That function was regionalized and then shifted over to the BHOs. And then the governor further decided that really even the BHOs shouldn't do a whole lot of treatment. They need to have the money go from insurance companies to the clinicians. So in terms of the grant, this is our contribution to providing treatment for those who don't get treatment elsewhere.
And the specific answer to your question is the BOH, the Board of Health, is not an instrument that receives grants. They
Right,
may
right.
advise us on it.
Right. I was just wondering if they could advise if the board can ask them to allot so much funds to facilitate these various interests, I don't know if you could, like I said, transfer or pay for different entities with those kind of funds from the Board of Health.
I don't follow that, do you?
I don't think the Board of Health
Okay,
to date, they don't get money to provide treatment.
right.
What they
But they
can,
certainly, they can certainly make recommendations for us to emphasize different programs, but
yeah.
That's kind of what I was speaking about. Okay.
now the BHO does have an administrative service organization that does get some funding from the state for mostly the kind of the emergency response units that come out to what Troy was kind of hinting at that happens in the after hours. But I think it's a 5-county region and they've got 4 individuals that can respond. So it's a pretty long lead time, and they have to be trained individuals that know how to diagnose and make recommendations.
Yeah, that's specific to what they call DCR, which is a person that can say
Designated.
the person in question needs to be treated even if they're not agreeing to be treated. And there's a long process then, but they're they're the crisis responder that is authorized to call the sheriff and say, put this guy away for a moment or take him to St. John's, even as they don't, as they scream and yell. And there are, you're right, there are not very many of those. I don't know the number. The other ones are the mobile crisis response team. And in a sense, you just heard, we fund 2 of them in the sheriff's department. And Columbia Wellness has a contract to deal with that in the county, and Core Health does too, maybe.
Yeah.
And those
I
things
don't know.
do change a little bit, so. And that all gets funded, those get funded through ASO, the Administrative Services Organization.
All right, thank you.
We did have a question in. Can some of the money the county didn't use for various health-related activities, I think they're talking about the foundational funds, be used for some of the activities you're discussing? I know you and Carol put together kind of a list of what other counties use that for, and I don't remember all the categories in there, but I guess my answer to it is we continue to look at different ways we can use that fund, and I don't know if I have an answer that can be specific for this, but I know that there's been exploration of how to use that, and I know there will continue to be, if that helps answer their question at all.
Yeah, it might be good for Jana to explain again some of those funds that get returned, because there seems to be a lot of confusion. It's like,
Yeah,
this board decided we didn't want to spend that, and that's not how it operated.
no. Go ahead.
I'm sure you explained it, and I just didn't follow, but on line 100 and 101, those 2 behavioral health responders, that the increase for their full-time employee positions, both of them went up by roughly 24%. And the reason that big increase for them is
The behavior, the 2 officers,
apparently is that 100 and 101?
we used to
Yes.
contract that out, and then we brought it in-house. So I think part of
Right.
24 was still we had paid under the contract, so we didn't
Right.
have that officer for the full time.
So in 2024, we had it externally contracted for. And then we brought on these 2 individuals, and they weren't at the beginning of the calendar year. As opposed to 2025, it's a full 12 months of those positions.
So
So
that,
2024 is a partial year of their salary.
These are 2 individuals that were the same people that we're now taking into the county, into the sheriff's office. It's not different people. It's the
Right.
same 2 people we're just taking away from a contractor.
it sort of doesn't matter, but I think that's true.
Yeah.
If you take the 50,000 and add it to the 95,000 plus 103,000, you should come up
Real
something
close.
just slightly below what's in 25, right?
No, it's actually higher in 2024, because when we were under contract, we had to pay some additional expenses as overhead, things like that.
Right, right.
So, but when you see the FTEs for 2024, they're not for a full 12 months. That's why they look different. One is partial year and one is a full 12 months.
Oh, okay.
Yep.
Okay, thank you.
Yep.
That was a good catch.
And of course, the 2025 budget includes the pay raises and the
Yeah,
cost of living
Yeah,
adjustments.
the 3.5% COLA.
And actually, I think we're happy with bringing them in-house versus being them contracted out. It seems like we have cleaner access, or I don't know if it's cleaner, but
I'd look to
more
Troy.
timely.
Yeah,
Yeah.
I had argued that I preferred that to start with. I don't know if Troy recalls that. I mean,
It is a shorter path, less overhead.
yeah,
Yeah.
yeah. It's always nice to control your resources.
Okay, anything else? I don't see any other questions, so nothing else. We will adjourn. Thanks, Kathy.
Okay. Budget workshops next week too.
Yeah, I know. It's a weekly.